Hi, good morning. It's Olivia, and on Facebook, I'm known as Olivia K. I am also Warm Yam on Reddit. And what I do is make videos or give advice online to see how to I can help people uh, pass NCLEX. It's not an easy feat. It's a very difficult exam. I know people will try to argue me and say otherwise, but I taken it like at least 3 times. Once as a PN, and I successfully passed the first time. Failed the first time I did the RN. Passed the second time when I took it. So um, I'm here to tell you it is possible to pass, and no matter how many different attempts, you will get there. Remember this when I tell you it's not failure; it's rather a delay. Okay, so let me get into it. So I want to talk about fundamentals. Why fundamental is very important. So the one thing, the one concept that's going to be always constant when you're taking the NCLEX is using the nursing process. So that's assess, data, plan, intervention, or implementation rather, evaluation. And whenever you are asked questions on the NCLEX, every single question, I don't care what kind of question it is, whether you know it or not, whether it's a concept based or not, is you have to use your nursing process. They want to see that you can think as a nurse and think critically. That's part of thinking critically. You're gathering important information and then applying it when you approach a question. It took me at least like 1 or 2 times to understand that concept because I studied the first time I studied, I was mostly studying med surg. And while it's great to have the knowledge of diagnoses, oh, sorry, diagnoses and pharmacology knowledge and knowing therapeutic communication, that's not enough. It's more important that you do know these concepts, but also understand what is being asked. And I think a lot of people can miss the mark if they're not focusing on the fundamental piece. So as I'm saying, add pi, what like that's almost every single question you're going to get in NCLEX. There's no running away from it. They need to know if you can access the patient, and with the nursing process, what are you going to do to keep this patient safe? Are you going to intervene? Like when you intervene, is it going to keep the patient safe, or are you going to make any complication worse, or worsen the patient rather? So very important. Vitals, you need to know how to do vitals. Every nurse should. And sometimes that's the obvious answer in a question. Sometimes it's like there's something else you could do in order to keep the patient safe. So another fundamental concept you should also understand is infection control and safety. Again, this is a safety exam. So that's also fundamental. So it's important you understand the disease processes that have certain precautions, right? There's airborne, droplet, and I know you're going to learn that when you're doing your study guide, like going through your study guide. Like if you use Marquet, he goes right into it, and he does an excellent job breaking it down. So it's important to know also the PPE. And for RNs that are taking NCLEX, right? Or sorry, for those who are taking the NCLEX, it's super important you also know which patients is best to room with. What patients should be private? What patients should be semi-private? It's important to know because they want to see how are we going to stop the spread of infection. How are we going to prevent that other patient from getting sick? So it's important to also look into that. So which is why I say fundamental is key. And you know that concept before you're going to apply that when you ask that on the NCLEX. So certain patients who just had surgery probably shouldn't be with a patient that has contact precautions, right? And they should be private anyway. So that's one example. And another example I can think of is uh, somebody that has TB that's in the latent stage versus active, they should not be in the same room together, right? Because if they're latent, they're not able to spread the germs. I may get that wrong. So if I get that wrong, you can comment down in the section. But I know with active, they need to be in the they have to have their doors closed. And they're very infectious. You have to have your N95 masks. So it's important to understand too the PPE, as I was saying earlier. So also look into that. Another thing is the ethicals, the legality. HIPAA, definitely know their patient's rights. So that's something they also ask as well. And like I said, it doesn't matter what kind of patient it is. It could be psych, maternity, pediatrics, home, whatever. HIPAA is very taken seriously because we have to protect the patient's privacy, and we take an oath each time we take the NCLEX to uphold that. We can't disclose what patients who, right? So that's very important. And then basic patient skills too. As I said, like bed making. I know that's what UAPs do, but that's something. So say newly trained UAP comes to a unit and they're messing up a procedure that they're supposed to do in their scope. It's up to us to know these things, because that's what we do. We're supposed to correct, and then we teach them the right way of doing things. So which is why I say basic, it's important. Fundamentals is important. I know it's kind of laughable, but it's very important. Then what else do I want to mention? Communication, therapeutic communication. That should always be a constant. So whether, again, is psych, maternity, I know, therapeutic communication is very important. That's something that, that concept is something that always carries through. Sorry about that. I was just having a little brain fart for a minute. But you get the idea. So fundamentals is something I stress. And for this reason, because no matter what kind of nursing discipline you learn or you're getting asked about, the fundamental basics will be there. Positioning, very important, especially when a patient may have a medical emergency. So you may need to put a patient in semi-Fowlers. The patient may have to be in high Fowlers, Trendelenburg. It depends. Or their legs have to be up and the head has to be flat. You don't know. You that's why these things are so important, because you don't know. And let's, like, if you see this question and they're telling you this patient has increased cranial pressure, what would the nurse do? What's the best action? So do you want to put them flat? Should you have the TV up? Should they be on high Fowlers? Or put the TV up high. So the best thing would be that they're in high Fowlers position, because that's the best position for them. And then all the pressure goes down gravity. And also, you wouldn't want to have the TV on and put them flat, because that puts increased pressure to the brain. And then you don't want as much loud noise, because that's going to irritate them. So safety. So that's the whole point of what I'm trying to make. Then med administration, the 6 rights, or I don't know what policy or your state follows, but I know for me it was the 5 rights of MedPass. Another thing they may ask, they may not ask that, but it's good to have that those concepts when you're doing pharmacological questions. So what I'm trying to tell you is, if you know the concept, that is excellent. That's great. That's important for you to have. But also, fundamentals is something you want to try to double check on before you think of reviewing and sitting down to take the NCLEX. Do you understand the basic foundational knowledge? Do you know what the fundamental concepts are? So again, not just, like I said, not just like the diagnoses in pharmacology. Like, do you know your labs? Do you know the complications when it comes to IV care? What are you looking for? Is their arm swollen? Is the skin cool? Which is why I say ADPI is important, because you need to see what's going on. So every person should have that. They should have that concept. And let's see. And scope of practice. Scope of practice. Know your role. Know what you're supposed to do under your license. So hopefully that all made sense. And I know it's a quick video because I have to kind of get going, but I'll leave more like maybe so some tips in case you leave a comment, some tips if you need, and I can leave some links to any fundamental easy concepts for you to learn, because it's important for everyone to have that. Whether you're testing for RN or PN, you have to have that fundamental knowledge, because how you're a nurse, right? You have to have the foundation before you can go up. That's the way I see it. Anyways, I hope you have a wonderful day and take it easy. Bye.